Ladies and gentlemen, I'm grateful to HealthCore and all of you participants for giving me this opportunity to say a few words at this very special forum. Now, we are going to talk about not just the pandemic, but mainly about what should a leader be, or how should a leader behave during difficult, tough times like now. Now, what I might be saying is not from any textbook, it's not from any lecture that I've heard, it's all from what I've learned being in the forefront, not just here in Malaysia, but the three major tertiary hospitals we have in Indonesia, and also from stories we've heard being part of JCI, and that is also something I've heard experiences from around the world. Now, when you look at times like this, we wonder, who is a leader? Now, what does it take to be a leader in times like this? You can't go on as business as usual and going on the same principles. Some leaders think they are God, or they are treated like gods. You cannot be. You are not God, but even God would want you to be different and be approachable and be able to go and meet with people around you. Does poor leadership affect today's organizations in disasters or in pandemics like now? Yes, poor leadership does. It's because no leadership has been trained how to handle a pandemic like now. Because even if you look at the news reports from CNN and other places, Anthony Fauci and the others are struggling month by month, trying to make out, how is this virus going to change? You have to change your thinking. You have to change the way in which you carry out your care for the patients and look after the staff. Principles of leadership have changed over time. You are not just focusing on your patients. Patient safety was paramount. Now you have to also think of staff safety. And we see in many countries, staff who have not been cared for enough, revolting or going on strikes or giving up their occupation and going on to other forms of their career. So these are things we have to adapt, and a leader has to look at this. I remember when we first started, it's the Indonesian hospitals which were impacted the most. 2 of our doctors and 1 of the ER staff passed away. One of the doctors was a 32-year-old neurologist with a young wife and 2 children. And just after he passed away, we realized the wife was expecting again 3 months. Now, the staff were upset. We were upset here in the headquarters in Kuala Lumpur because we couldn't reach out to them. We couldn't go there. And some of our staff want to be hugged, want to be touched, want to feel that they are cared for. It is not anything more about the amount of money the hospital made or things like the awards the hospital has got. All that becomes very trivial and unimportant during pandemics. A leader has to focus on your staff. And I've always believed that if you look after your people, they will definitely look after your organization. And leader has to learn to give in and invite others who know better to take over. You can't be there always. You might be tired. Reminds me of this flock of geese flying in a V shape. It's often given as an illustration for leadership. The lead geese takes a lot of strain being in front, getting the full impact of the wind beating on it. But after some time, they're too tired. He can't continue in that position. He moves aside and another goose sort of comes to the front. And this is done in a very coordinated way, and they take turns to take leadership. So when we see people around us getting burnt out and getting tired, not just the leaders, the CEOs, but also the nurses, the managers, especially in the intensive care units, we have to look after them. Now, this is something which the governments of the day, the ministers and secretaries of health, the CEOs of hospitals, the group CEOs, the nurse managers, the medical directors, all of them have to realize this and make sure that your staff are supported and we take turns. Now, when you look at the pandemic, we don't know when it's going to end. There were many false alarms. When we first started in March of last year, we thought it would go on for a few months. And then the numbers started coming down. I remember in Malaysia, we went down to almost, or rather we went down to a single digit new case every day. Yesterday, after having had so many ups and downs, we had 24,000 new cases in a single day. Now, this is something which we don't know where it's going to end. We thought the vaccines will stop it all. But again, there are people who don't want to take vaccines. And again, this is a failure of leadership by the country, by different places. Leadership can influence people. We know what has happened in some of the bigger countries in the West, where leaders have said it's dangerous to take the vaccine. Until today, people have not. Unfortunately, they realized they should have taken the vaccine only hours before they died. And we as leaders have to make sure, and we as competent and capable leaders have to look at how we can pass on timely messages and the right messages. We have to send these messages to the customers, which are our patients, and we also have to give it to the doctors who come and practice with us. We have to send these messages to the investors, the people who own your hospitals. This is not a time for them to start thinking, why are my profits down this time? Because you have to spend as much PPE, as much money as possible, or you need for PPEs, for gowns, for all kinds, for medicines, for food for those in ICU who got no time to go and eat anywhere else. And we have to give this. Sometimes we have to accommodate them in hostels within the hospital. We have to look after our employees. And we also have a duty to look after as leaders of the community we are in. We have to teach them about the disease. We have to teach them how we can prevent ourselves from getting the disease. We can also teach them about vaccination, about taking tests like the swabs, PCR tests, and the use of masks, why it's important. Now we're also talking of double masks. So we have to strike a balance between the pursuit of service excellence and trying to look at how we can be excellent in our service and look at customer engagement or staff engagement and patient engagement to make sure that our services go on well. Now, we also have to work with the government. Many of our countries we know have been talking about public-private partnerships. It never happened. The public sector thought they can continue to survive on their own. And the private sector said, we have excess capacity, we want to work together. But in times like this, the public sector are overflowing with COVID patients, and they have come to the private sector and said, can we work together? Can you take some of the non-COVID patients to your hospitals? And in fact, in Malaysia right now, most of the major private hospitals have got into treating even COVID patients category 4 and 5 with ventilated patients and patients who might not make it through this disease. So leaders have to modify how they practice, how they deliver care, the strengths they have, the equipment they need, and we have to survive as a team. I remember there was a time when the government said, the public hospitals cried out saying, we don't have enough ventilators. All the private sector hospitals got together and sent 95 ventilators to these hospitals because they felt that they could spare these. And these are ways in which leaders have to look at, and this is not something we were expecting to get back, but we voluntarily gave this equipment so that another person could live. Now, I don't want to seem to be going on the negative side, but I must say that being a leader meant, at one time, it meant that I told you, you're God, or the stronger person wins. And it was Mahatma Gandhi who said, today, getting to be a good leader, it means getting along with people. So we have to have an environment which is a non-blaming environment. We have to exist together. We have to cooperate together. We have to be transparent in our communication. We have to look at ways in which we can support each other, not just our staff, but also the patients, the families, and it is the whole community which make up the country that we have to look up. If we don't do that, you will find that there are uprising among staff, many staff giving up the medical profession or nursing profession, and they don't want to work anymore. Sometimes it's not the staff itself, but the spouses seeing them getting stressed out, coming back exhausted, not being able to do anything, which makes them. So in conclusion, I just want to say this, especially in times like this, leadership needs each person to know your people. Not just knowing them, but you have to know their families as well. You have to look at what are their needs. Do they need more PPEs? Do they need to take home PPEs to share with their families? You must be available to them day and night. It is no more office hours or after 5 you can't call me. They should be able to call you at any time. That is a true leader. Because you might be worried, it's your neighbor who's turned positive and you've been exposed. Do I come to work? Is my family going to be safe? Can I come and get my whole family tested? You must be approachable. You're not sitting in an ivory tower in your hospital or in your organization. You must be approachable. You must go down, meet them in the lift, talk to them in their corridors. That's where you get the maximum input. Now, be transparent. Give them good news and bad news. If you know about a variant, one of your staff has been hit by the Delta variant, tell them. They want to know, and they'll help you how to be able to contain the spread. And don't be afraid to ask for advice. I think this is something, especially times like now, we learn from others. Others might know more. If we can learn one extra fact about the virus, that is something huge. And don't just let the staff know. Don't let the staff think that they are not important. In fact, I must say they are the most important people during times like this. If you don't look after them, that is a disaster. Not only will they go on a strike or they leave your organization, but they won't be able to give their best. They don't, again, I look at CNN for many of the stories told about staff who want to give up, staff who have resigned, but the next day the staff is still in the hospital. And when they asked her why, she says, I can't leave my colleagues struggling like this. I need to work alongside them because together we are saving lives. Now, I just want to say this last thing. When we have safe people, we must celebrate successes. When we have lost patients or we have lost staff, we must celebrate the failures that we had and learn from it and look at how we could have done better. And ladies and gentlemen, I must say this, it is a job for all of us, to work together and make sure that all our combined efforts can make a difference, not just in our hospitals, but for the nation and for the world as we move to get rid of this pandemic. Thank you, ladies and gentlemen.